And good afternoon, and welcome to Straight Talk Drive at 5. This is Catherine Tyson, your host, and welcome to Monday. In the Straight Talk studio this afternoon, it is Medical Mondays, and we're talking about men's cancers today. So, if you've tuned in, you are in for a lot of information about men's cancers and primarily prostate cancer today. So, in the studio, we have our guests, of course, from Health City, the Global Sales and Marketing Manager, Miss Tiffany Dixon Ebanks, who's from Health City, uh, Health City Consultant Urologist, Dr. Prabhuling Konnur, and we're going to call him Dr. Prabhu from here on, okay? And the Operations Manager at the Cayman Islands Cancer Society, Miss Jennifer
Weber like the barbecue
Weber.
grill.
Where's your double B? I know I say this every time.
I know. It doesn't make sense.
Every time. Well, thank you all so much and welcome. Good afternoon.
Good
Good.
afternoon. Thanks
Good
for having us.
afternoon.
Good afternoon, Catherine. Thank you for hosting us this evening.
Absolutely. First time I've seen Miss Tiffany on this front because normally it's Shamari Scott.
Yes.
But you and I, we got history.
Yes, we do.
We
We,
got
definitely
history.
have
Good
history.
history.
Good history.
history.
So it's good
to see you.
and good to see you in a different capacity as well.
Absolutely. Yeah. This is one of my regular chairs that I haven't been in for a few years. So, you dust them all off and you end up in there somehow. So it's really good to see you for sure. All right. So we're talking about this is Medical Mondays, of course, is brought to us by Health City, and we're here to talk about men's cancers. Tell us a little bit about your guests here today, Tiffany, and just
Yes.
bring us up to speed.
Yes, so I'm happy to have to my left, well, your audience is not sure if it's top, bottom, or on the screen, but Dr. Prabhuling, we call him Dr. Prabhu at the hospital. We like the first names. He is our consultant urologist at Health City, Cayman Islands, and he has more than 30 years experience between Cayman, India, various other places. I will allow him to kind of share more about his background. Very experienced consultant surgeon with Health City Cayman Islands. He received his master's in urology from Bangalore Medical College in India. And he also worked from 2010 to 2013. He was a consultant urologist with Narayana Super Specialty Hospital in Shimpa. So he comes with a wealth of experience. We've been on this show as well as other shows just talking about the wealth of experience of our doctors, and I'm very happy to be in his company this afternoon. Obviously, we're going to be talking about prostate cancer. We're in November now. Last month, it was all about breast cancer. We have Jennifer Weber in the studio with us. Now we're turning the spotlight on the men. Not to say that men can't have breast cancer too,
True.
because Jennifer will correct me. The prevalence is higher in females. But we're turning the spotlight on men's cancers today, and we basically seek at Health City to shed a light, to build awareness of these health issues in the Cayman Islands, in the community, to ensure that persons know, these are the things you need to look out for. We're here for you. We're wanting pinpoint this is an issue, and when you need to see your doctor, to ensure that there's not a larger issue that you need to be addressing. So we're happy to have Dr. Prabhu today, and we at Health City as well, it's Medical Mondays, but we also like to share limelight with certain members in our Cayman community who are doing awesome work. Jennifer Weber is not a stranger to us. We've had her on with us on several occasions in the past. So we're happy that she was able to come on today as well to talk about prostate cancers with us. So without further ado, obviously the majority of our conversation today will be shedding a light, and we'll ask for Prabhu to give us his insight from a medical perspective so that your listening audience can learn something this evening.
All right. Okay, great. So let's hear from Dr. Prabhu.
Good evening, Ms. Catherine, Ms. Jennifer Weber, and Ms. Tiffany. Today, the topic is prostate cancer. Obviously, it is the cancer in male. Okay, prostate is supposed to be the one of the gland situated at bladder neck. Okay, between the pelvic floor and the bladder neck. It is one of the sexual organ in male. It has a multiple functions to play in the body. Okay, it is one of the sources for reproduction system. It's one of the important gland in reproduction. Having said that, one of the bad part of the prostate is high incidence of cancer in the prostate. It is estimated that it's the second commonest cancer in male, and that is the second commonest cause of death in males. If you go into the statistics, almost 150,000 patients die every year in US alone. In US alone.
Okay.
So just take throughout the world, it is quite high, and it's very one of the important cause of mortality in case of male deaths.
Well, it's funny because I normally start the show with like something motivational, and I found this when I was looking about today's show being Medical Mondays, brought to you by Health City, and we're talking about men's cancers. And I thought, I found this: a man too busy to take care of his health is like a mechanic too busy to take care of his tools.
Yeah.
I thought that was great. And also, I found another one. If you don't do what's best for your body, you're the one who comes up on the short end. And the last one that I found was health is the greatest of all possessions. A pale cobbler is better than a sick king. And I thought this was just so perfect. Like when I heard that, because I just thought, oh my goodness, like men tend to, just go, 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 go. And they never really complain about anything, or, it's always that they're the man and they're fine. They're going to take care of the family. They're going to take care of what they have to do. And it's almost like it's not like a strong thing to do to look about your health, but actually it's a responsible thing to do to look about your health, because you do have a lot of people that depend on you. Isn't that right? And so why wouldn't you understand that your health is paramount? Because these people that depend on you, if you don't take care of your health and something happens to you, then you fail them just because you didn't do the right thing. You know what I mean? So what's better, to think, well, I'm not going to look about my health because of whatever, or I'm going to take care of my responsibilities and ensure that I'm okay also. So, Miss Jennifer, what do you think about that? Kind of true, right? You
It's
work with
absolutely
cancer.
true. I agree with you 100%. I love what you said about that. We often have to try to find ways to motivate men to pay attention to their health. And honestly, sometimes we wonder if they really do pay attention, but maybe they're afraid.
Right. Yeah.
So
Is that it, you think?
so sometimes we tell women come into the office and we tell them that they should bring their men to whether it's their uncle, their brother, their father, their husband, their friends, to this event that we're having on November 19th at the Lions Center. It's about men's cancers. It's prostate cancer and colon cancer. And to Tiffany's point before, men and women can get breast cancer, and men and women can get colon cancer. But the Lions Club of Grand Cayman, who we cooperate with for this event, they lost a member to colon cancer. And so colon cancer is very special to them. So they want to make sure that they educate the community as much as possible about that. And so we have this great event, but we have to figure out a way to get the men there. So sometimes it's the women bringing the men, or it's the women saying, oh, I want to go and get the information about colon cancer. Just come with me, and then you can listen to the other thing if you want to. Sometimes women tell their husbands, oh, they're going to have chicken wings and patties. And so you can come for the snacks.
Yeah.
And then other times they're motivated because we have nurses, phlebotomists, who are there on site, who will do the blood test, a PSA test, which is a screening test. that checks for a particular kind of antigen in the blood. And so it's a simple blood test. The blood is taken from your arm. Men get nervous about where the tests are taking place, and when they hear 3 letters, they start worrying about some other kinds of tests. This is just a simple blood test. You can come, you can get it done right there, and get your Band-Aid, then go out, listen to the talks, get some snacks afterwards, and if you have questions, you can stick around and chat with the doctor. And every time we do this, we have at least 2 guys who come back with high PSA scores, but it's not because they have prostate cancer. It's because they have some kind of infection. And so we talk to the guys, and when we call them and say, oh, your score came back high, come and collect your scores, and then you can go see a doctor. And then they say, well, I've been having some trouble. And we say, well, how long have you been having trouble? And they go, oh, about 2 years.
Right.
So they had pain and burning when they're urinating for every day for 2 years, but they never went and got it checked out. And when we say, how come you didn't get it checked out? And they say, well, because I thought it might be cancer.
Wow. Okay.
So they'd rather avoid it than go take a week's worth of antibiotics.
Right.
So we want to encourage men to, come out in a group. The guys that you typically play dominoes with, or your book club, or the people that you go to rugby with, or whatever it is that you do with a group of people, a group of friends. On Thursday night, everybody get together and have a man's night out, if that's what you want to call it. Go get the information. You'll be in good company. It's 100 or 200 men. I promise you that someone in the crowd will ask a question that you're too embarrassed to ask. Every year, the men ask the same sort of questions. I'm one of only about 4 people in the entire Lions Center that night. And all the men like to try to talk about the topics that men are interested in, right, to make each other laugh at this. But if you come, you don't have to ask a question. If you just listen, you're going to learn a lot. And if you're motivated to ask a question, you're welcome to do that privately or publicly. It's a great event, and there's only one of these in November, so we hope men will turn out at 7.
All right. Okay. And we'll talk a little bit more about that as the show continues. We'll also talk a little bit more about prostate cancer and maybe signs that men can look out for. When it comes to their health, too many men don't talk, they don't take action, and they die too young. So this is Movember. Is that what they're calling it?
It's Movember. So the Mo comes from the word mustache, M-O-U, mustache, and the Vember comes from November. And so you put the words together, and it's Movember. So it's the month when men grow their mustache to raise awareness about men's health issues.
Okay. And Movember is the only global charity focused solely on men's health. The foundation raises funds to deliver innovative breakthrough research and support programs that enable men to live happier, healthier, and longer lives. So this is the shaving the mustache that occurs every Movember, right?
Yeah, so it's a worldwide movement. I'll tell you, before I came to Cayman, I'd never heard of this. Apparently, it's big in Australia. I didn't know. I arrived, I had this job, and people started talking about Movember, and I was nodding, and I had no idea what they were talking about. Okay. So it was brought to Cayman by a guy from Australia 12, 15 years ago, something like that. So he came the first year. He shaved his mustache, or he grew his mustache, collected donations from a few friends, came into the Cancer Society, donated $200 and some. The next year he got some more friends, and then it turned into this big movement. Now Movember is a month long of all these different kinds of events, and it's the Movember Committee, the Lions Club of Grand Cayman, and the Cancer Society, all 3 of us working together, and the overlap is this education night. Movember as a group, they do lots of different things. They focus on golf, they focus on men's health, but the cancer night is the 19th, and that's our big thing.
Okay. And
Interesting.
Yeah, for sure.
Yeah. Now, so I'm sorry. Can I just say one thing?
Sure.
You mentioned that there's a foundation. It is a worldwide movement, but I want people to understand that every dime that's raised stays here in Cayman. There is a foundation, but we don't send any money overseas. Right. So all the money that's raised here. So if you're donating $5 to your friend at work, that $5 is staying here in Cayman. And actually, the money that we receive from fundraising is the money that we use to pay for those lab tests, those PSA tests, because we do them at this event, but then we also make them available year round for guys who need them.
for free.
Free.
For free.
Well, free for
Okay.
the guys because we're using that Movember money to pay for them.
Okay, great. So yeah, so if you're supporting that, you're supporting this cause.
Right.
So
And helping
absolutely.
men in this community.
Yeah, absolutely. So now I know that Health City, maybe you can talk a little bit, Dr. Prabhu, about some of the urology services that they do have at Health City.
Yeah, since 3 years we have been here giving a urology facilities. See, almost all surgeries in kidney pertaining to kidneys, so which are involving either it may be a stone, it can be infection, it can be a cancer, or it can be anything. So we are in a state to give the help to the patient, especially in the cancers. We are cancers of the kidneys, cancers of the bladder, cancers of the testes, cancer of the prostate. So we are well equipped. Okay, though we are not in par with the world, but then we are very well equipped, and we are in a state to give them the best of the best treatment on the island.
Okay. Now this is your area of specialty.
Yes.
And when did you choose that this was your area of specialty, and what was is there a reason behind that?
Yeah, it was. I had a fascination for surgery right from the beginning. Of course, it's my personal. Then when as a student, when you go into the hospital premises in a hospital, we see a lot of urology cases in those times. Even now, almost 25% of the hospital beds, okay, will be occupied by the urology patients in
Wow.
India.
Okay.
That's a
Okay.
huge number. That's a huge number. So looking at that statistics, I thought, yes, let me take up my urology as my profession. So I got trained in the urology in 2003 and graduated. And since then, I'm into the urology.
Okay. All right. And so urology services available at Health City include kidneys, urethra, the bladder, testes, penis, and urethra,
Yes.
prostate, and also diagnostic.
Yes.
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 And this is and anyone can experience any issues. The prostate itself is a man's. Women can't experience that, but all of the other things that we talked about are just it has no gender, right?
Yes.
Yeah.
Okay. Little going deep into the prostate. Okay. By its situation, it is deeply situated in the body. So it's not so easy to approach that gland or investigate the gland. So that means any problems with the prostate, they surface out quite late. Okay, it's not the early stage of the disease where we can pick them. So that is why the phenomenon of screening for the prostate cancer is gaining a big momentum. Okay, that's the most important part when you're dealing with a prostate. So what is this screening for the prostate cancer?
Right.
The main aim of this is to catch the disease when it is curable. Okay. The moment it starts producing symptoms, we conclude that it is beyond our capacity. Okay, it
Okay.
has gone out of our hands. So that is why we are very skeptic. Whoever comes to our hospital above 40 years of the age, I make it a point to investigate for his prostate health. Unfortunately, many people they refuse for this. I don't know why it is. Either they are shy, or they are scared of the disease, or they don't want to face this problem. We don't know. There are multiple reasons they go out of this. But anyway, we always try to convince them. Okay, make them sure that they come for the investigations. So one of the important signs and symptoms, as I said, the earliest signs and symptoms, they never surface out. Any cancer in the prostate, the earliest stage, we have stages in the cancer: stage 1, stage 2, stage 3, stage 4. Stage 1 and stage 2, they're totally silent. They're totally silent. It is only the stage 3 or stage 4 it starts producing symptoms. The mere backache may be the first symptom. The you burning sensation in the urine, that's called dysuria, we call it, maybe the first symptom. or occasionally they may find some blood in their urine, hematuria we call it. So these are the few things. They can come with a retention of urine. So all these, unfortunately, they're the late manifestations of the disease. The earliest is no manifestation. The only thing is catch them when they are treatable by screening.
Right. Because it
So-
might be too late depending on the time
Yes.
that you caught it. Yes.
Okay. So
Okay.
in the screening, the most important, whoever comes to my urology OPD, the digital rectal examination, I always ask them to get their digital rectal examination. It is simplest. It can be done within a minute. Okay. It doesn't require much finance. It is a cheap, best, and most reliable. It's the most reliable investigation to catch the prostate cancer at the early stage. So digital rectal examination. That's why I advise. I think carry home message for today's talk. I request every Caymanian to come down, get your rectal examination, digital rectal examination done at least once in a year, so that you pick your cancer at the early stage. This is a carry home message. Please don't shy away. It is life and death. It's the most important thing. I want every man above 40 years to practice to be healthy.
Right. Absolutely. Okay. And so Movember will be on the 19th of November.
That's right.
All right. And that's going to be at the Alliance Community Center
Mhm.
from 7 to 9.
Right.
And
That's our education night. It's a joint program of Movember, the Cancer Society, and the Lions Club of Grand Cayman. Yeah, it starts at 7, goes until 9. When guys come, we're going to have Miss Cayman there, by the way. So you can come for the patties and chicken wings and see Miss Cayman, and in between get some good information. You can come and line up. You'll fill out a form, then go get your blood test. It takes just a moment. We have lots of labs there, lots of phlebotomists there, so the line goes very quickly. Then you come out, you listen to the doctors. There's 2 doctors who are going to give a presentation. One will talk about prostate cancer specifically. The second one will talk about colon cancer. And then at the end, they have refreshments, and the doctors stick around to answer questions. So it should wrap up around 9 o'clock at the Lions Center.
Okay. And I mean, you're sure about the patties and chicken wings because you mentioned it twice. So
Well, so this is the thing. So
pretty important.
well, it is. I'm telling you. So the sponsorship pays. The sponsorship pays for the snacks. This is a big deal. The guys
just wanna
don't
make
turn
sure
up
that
unless there's
that-
snacks.
Because you mentioned specifically patties and chicken wings. I don't want to get there and then it's like,
Well, so you know what I didn't mention.
Broccoli.
I didn't mention heavy cake because sometimes there's heavy cake and sometimes there's not.
Okay.
So
I'm kidding. by
it
the way.
depends. But yeah, that's sort of my common joke with the Lions Club of Grand Cayman. They're mostly a male group, so they're doing carry out.
Yeah.
They're not baking themselves
Okay.
because it's mostly a male group.
Okay.
The Lions Club of Tropical Gardens, you're more likely to get homemade things. But
Right. Okay. So
uh,
come for the chicken wings. Stay for the PSA.
yeah.
Yes.
All
and-
right.
and
I
we're
think that's
yeah.
a new tag.
I
And
like
we're
that
saying
tagline,
lots of
Catherine.
letters. Remember the
Thank
test
you.
that we're doing at the Lions Center. This is free for everybody who wants to come. And the PSA test is just a screening test, and it's a blood test. The other test that Dr. Prabhu was talking about is the digital rectal exam, the DRE, and that's for the next step. We will not be doing that at the Lions Center. If anybody comes up to you and asks you to go to the parking lot for one of those tests, they are not part of our program.
Jennifer, stop it.
And I was
That's
gonna
not the show.
I was going to tell Dr. Prabhu at the office, we call that in medical terms the pokey pokey backdoor test. We're not providing the pokey pokey backdoor
No,
test. That's
no,
another step.
Not in the parking lot.
No, not at all. Not at all. No, this is
Exactly.
a screening and a chance for information.
Absolutely. And
Thank you.
and Dr. Prabhu is a doctor. So he's like, it's simple. Like you want, this is saving your life. So
Right.
Yes.
it's not, when we're probably thinking a big deal of something or making a big deal about it, it's like you said, it's something done that's quickly and it's for your health. So
Yeah.
but on November 19th, it's just the PSA test. It's a
Mhm.
blood test, and it's just going to tell you basically what your levels are, right?
Yes.
Yeah.
And if I want to
Okay.
stick a pin, I would love Dr. Prabhu to just explain a little bit more about it. So, as the non-medical arm of Health City,
Yes.
for me, PSA test for your listening audience,
Yes.
what does that
Okay,
mean?
Very interesting.
Prostate-specific antigen. So, Dr.
Right.
Prabhu, please let
Yes.
them know.
Absolutely.
Yeah.
PSA is a very interesting question. It's very
Yeah.
informative to all the people should know this. PSA is nothing like it is a protein in the blood.
Mhm.
Right.
It's one of the proteins, okay, glycoproteins. Okay, this protein is produced by the cancer cells.
Hmm.
So any cancer cell, even the smallest quantity, can be calibrated, can be estimated by the amount of PSA produced or estimated in our blood. Then you can say, what is the normal level of PSA? It is between 2 to 4 nanograms per deciliter. Supposed to be the normal finding, normal prostate specific antigen protein in the blood. Anything above 4 is suspicious, then starts. So anything above 10, yes, we start investigating. Anything above 100, yes, he has a metastatic. Straight away with the PSA, we can say, we can assess his stage of the disease. So we have seen totally no symptoms, silent man who just walks into it, finds his PSA 100, 150, 200, then it's very alarming.
Right.
So that means the prostate, it is stage 3, stage 4. The
Right.
cancer has entered the bone. So that is why
Right.
before it goes up to that level, we want to catch the patient between 2 to 4, between the 2 to 4 and investigate him.
Absolutely. And I want to ask a couple of more questions about the PSA. We're going to take a quick break. You are listening to Health City Global Sales and Marketing Manager, Ms. Tiffany Dixon Ebanks. You were just listening to the voice of the consultant urologist, Dr. Prabhuling Konnur. We're calling him Dr. Prabhu, and Jennifer Weber, the operations manager of the Cayman Islands Cancer Society, the lady who's talking about the patties and the chicken wings. That's her. And we're talking about, everybody's hungry in here now.
Can't help
I
it.
didn't bring any. We're talking about Movember, and it's a free PSA testing for all eligible men, and that's going to be on the 19th of November. So just stay tuned. We'll be back for more. Don't go anywhere.
I would love.
Style Glam all kicks off at 7 p.m. GA tickets $25, VIP inclusive drinks $75, and cabana packages $200. Available now at eventpro.ky. Don't miss Lumina Beach, Saturday, November 21st at Coral Beach. Brought to you by Moet and Chandon.
My bills seem huge again, and I don't know what to do about it.
We can help. The Ministry of Commerce, Planning and Infrastructure has teamed up with CUC to give you the chance to win a home energy makeover worth up to $20,000. Not only will this lower your utility bills, it will increase your home's value. We are also giving away 8 home energy audits worth up to $1,900 each, open to all homeowners in Grand Cayman. Entry is open now via www.energy.gov.ky/competition. Use less, save more. Proudly sponsored by CUC, DART, Saxon, CEL Cooling, Foam Pros,